total confirmed worldwide cases, 114,638. That's up about 14,500 from yesterday. Total confirmed deaths, up about 200, 4,031. This is really, really good news. Look at that. We are still at 4,000 deaths when SARS came over here? Not SARS. What was the swine flu?
You know how many people here at work here got the freaking swine flu?
No.
I just talked to 5 different people who got the swine flu at this freaking place.
Really?
I think they're susceptible to disease. You've been hiring people who are susceptible to disease. Oh my gosh, I heard that. That one I heard.
Oh my gosh, it's happening.
You need to go to Syria.
I don't think that's what the CDC...
Totally free of the coronavirus.
Really?
Yeah, they say if you can go to a place that has no cases because they're mainly shooting all the people who might get it.
You won't get it.
No, you won't go there.
Okay. Dead. All right. When it came to swine flu, we had 10,000 people dead in America. The whole world has 4,000 people that have died. Does it seem like maybe we're panicking a little bit? I mean, I agree with the precautions because of the fear of mutation and the fact that we don't have a vaccine for it yet. But
it's still the unknown. That's what we're fighting against, right? All this fear is just we don't know how this ends up yet. We don't know. Is the mortality rate really 4 or 5%? No, but we don't know that yet.
Right.
It's not confirmed because we don't have all the cases measured yet. It's most likely, every expert says it's going to be probably between 0.5% and 1%, which is still high compared to the flu, but low compared to where we are now. Everyone thinks that's where it's going to end up, but we don't have that locked down yet. And until we have it locked down, people are going to be freaked out about it.
Okay, people are going to freak out more and more because the numbers are going to start going through the roof. Don't worry about that. We're going to be testing more, and you're going to see more and more people get it around you. Unless you are, I think, according to the CDC, 56 years plus, or you have any kind of complex, health issues, then you should probably stay at home. Anyway, active cases that are considered serious down from 13% to 12%. 4% require ICU. Listen, please, if you were at a big gathering, do not go to the hospital to have your child or you checked. People in Texas now, what is happening to you, Texas? What is happening to you? Too many damn Californians here. What's happening to you? People are going now into the hospitals here in Texas saying, my kid was at the park last week and there was a whole bunch of kids and I want them tested. You can't get your kids tested if they don't have any symptoms. You can't go in and get tested for symptoms. And relax on your kids. This hasn't killed a single person under 18. Not one.
Well, outside of China, that's true. I think it's under 9 in China. But still, it does not seem to be targeting.
It's not.
I mean, targeting.
Holy cow.
It does not seem to be affecting children.
Sarah Palin, did she come up with this?
I guess so.
Yeah. We now have 33 confirmed cases in the U.S., 4 more tracking suspected cases. I think that includes Texas. Yesterday, we found out that there was another one that happened in Texas. This one right by the studios, which I'm telling you right now. Seriously, let me be serious about this. Do you have a trigger where you're like, I got to stay home? I want to self-isolate.
I think fever would be a big one. I've told you, I've been sick for, I think allergy sick, but allergy sick for weeks.
You have it. You met with the people at CPAC.
I was at CPAC.
I met with several people.
Michael Knowles from the Daily Wire. Yeah. I did an extended interview
Diamond
with him.
and Silk?
I did not see Diamond and Silk.
Oh,
However,
you didn't?
I only saw Silk. I don't know.
Really?
I didn't see Diamond or Silk. But I did see Michael Knowles, who did a podcast with Ted Cruz.
Yeah.
Who is self-quarantined right now.
Yeah. Yeah.
Because he interacted with the guy they know has.
I think Sarah Kolk, who's our booker here on this show, she met with Diamond and Silk last week. Knows where she is today. Not here.
That's because she was terrifying everybody in the office. She has the sniffles. And so everyone's running away from her like she has leprosy.
My allergies are so bad. It's leprosy.
That is where we are not the only ones in this position. I mean, this is happening all over the country.
Yeah. We unfortunately stoned her to death yesterday before somebody could step in and say, hey, it was just
She has
allergies.
seasonal allergies, guys.
Yeah.
So,
hey,
she had
you
a good
lose
life.
one from time to time.
Exactly. We were just taking the Syria approach.
So we're just, by the way, if you're a booker on another show, you want to work here, we have a sudden opening. Rocks not included. All right. So the CDC officially recommends now that those over 60 stay at home.
Is this true?
Well, I'm saying it
You
on
were
the...
reading a story from the New York Post, which is a newspaper.
Yes, Dr. Nancy
Yeah.
Messinger, a senior CDC
And what did she
official.
say? What did she say? What's her
She
quote?
said, quote, having us household items and groceries so you'll be prepared to stay home for a period of time.
Okay. Now, does that say stay
wait a
home
minute.
for anyone
You
over
know what?
60? I don't
You
think
know
they're
what?
actually saying this. So listen to
Give me the exact quote, because everything else I have here is not a quote.
Every news outlet is saying if you're 60 or older, you need to stay home. And they're all reporting it that way. This is what their actual warning says at the CDC website.
56? You should stay home if you're 56?
No! It says
Okay.
you should stock up on supplies. That means prepare
Got it.
in case you need to stay home.
Got
right?
it. Got it.
Take everyday precautions to keep space between yourself and others. Social distancing. When you go out in public, keep away from others who are sick. Limit close contact and wash your hands often. Avoid crowds as much as possible. Here comes...
Avoid poorly ventilated space, which this place feels like I'm just closed in a little teeny
15,000
box.
square feet and 40-foot ceiling.
It is.
Okay. Avoid cruise travel and non-essential air travel. Okay. And here...
5-story roof on this thing. And that is where the ceiling is on this. I feel it's claustrophobic. The walls are closing in. He just turned off his mic. I don't know if you could hear that. He turned off his mic. He was coughing.
I'm sorry.
You have it.
No, I just had some popcorn. So if you were, and these are all just for people who are at higher risk.
Yeah.
So that is the 60
I'm
or
at
older,
higher risk too.
or really 80 or older.
Right.
And then it says during a COVID-19 outbreak in your community, stay home as much as possible.
There's 4 of
to
them
further-
in San Antonio.
You know what? They actually do define outbreak, which is an outbreak is when a large number of people suddenly get sick.
Right. China. Hello.
Yeah, but that's not in your community.
I am a member of the global community.
Seriously, though,
I
Glenn.
am bound and determined
Glenn,
to stay home.
Every place is saying this, 60 or older. This says during a COVID-19 outbreak in your community.
This is amazing.
It still doesn't say stay home. It says stay home as much as possible to further reduce your risk of being exposed. Am I wrong on this? I've seen this everywhere, and I have not seen a quote from a CDC person saying, if you're 60, stay home no matter what. They're saying if there's an outbreak in your community, stay home as much as possible. That's something totally different.
Okay, let me give you this, because I don't know if you knew this. Patients are confirmed to be shedding the virus via blood, mucus, spittle, and fecal matter. Now, I don't know about you guys, but I think we should stop sharing the fecal matter.
Really?
Should we stop playing with the fecal matter of other people? I don't know. It
You're not
doesn't
sure on that one?
specifically say that. I mean, what is spread by fecal matter? Okay, I think that's just a worse way of saying wash your hands. Is that what that is?
I would assume.
I would assume so. Can we stop using it? Because nobody's playing with poop except for monkeys. Now, maybe babies. Maybe a baby is really sick. Maybe it is the babies. Notice it hasn't killed any babies. Maybe it is the babies that developed this as a bioweapon, because I have opened the diaper of some of my children when they were younger, and that stuff is biological warfare. That is, you don't even recognize it. It is not what you put into that child that's coming out.
Could be another sequel to Boss Baby. Because if you know this, they
Right?
wear suits. They talk like Alec Baldwin.
We-
They're planning all sorts of
If somebody was
schemes.
going to do this, it would be Alec Baldwin.
It's fair. It's a fair point. And I believe that's in the CDC analysis as well.
Also in the New York Post?
Yeah, it's in the New York Post story only.
Oh, we got to talk to Justin, because Justin's the guy who writes this, and he's really good. And it wasn't until you said that I'm looking through all of the highlights, and I'm like, there's nothing in quotes here.
Well, this isn't a Justin issue. This is a media issue. If
I know,
Look,
but we got to be better than the
maybe
media.
there's another quote I'm not seeing in these articles. It's possible, but I've read a bunch of them looking for this particular detail because I have relatives who are over 60, and I'm trying to understand what the right
Call
advice
Justin
is.
and tell him I want him in my office, and I'm going to cough on him today. Okay? He'll never forget that.